So
But for what?
to do, we have to do like a project, and you can choose the like what you want to talk about. So I chose bacteriophage.
Okay, cool.
Okay, so the first question I have is what type of degree do you personally have to do research in this field?
I have a bachelor's degree in biology and a PhD in biology.
Okay. And how long have you been working with phages for?
Ooh. 10 years maybe?
Oh, okay. And what made you want to work with phages?
I wanted to work with phages because I thought that they might be one tool we might use to combat antimicrobial resistant infections. So I kind of got stuck.
Okay. And how many phages do you have, like in your collection?
Ooh, I don't even know. More than 1,000. I don't know, maybe 1,500, maybe 1,500.
Okay. And where do they come from?
Everywhere. So a lot come from local sewage or water systems, but all over the world. We have them, many of them from South America, Central America, obviously North America all over, Europe, Africa, and some Asia. But I don't have any from Australia yet, so maybe that's
And
next.
how do you find them and collect them?
Uh-huh. So we collect them from mostly water samples. So we just go out to the environment or to sewage or whatever and get a water sample. And then we filter it to get rid of bacteria and debris. And then basically from there, we test them on a bunch of different bacteria. And then from there, once we isolate a phage plaque, then we grow it up and then we have it in our library.
Okay. And I saw on your webpage that you have used phages that only infect bacteria that have a virulence or antibiotic resistance factor.
Mm-hmm.
Yeah, and why, when you use these phages, bacteria become resistant to the phages by removing their virulence or antibiotic resistance factor?
So they don't always, but that's what we're hoping will happen. And so the reason this often happens is because it's the easiest way to be resistant to that phage. So in a population of bacteria, there'll be many different mutants within that population. Yeah. And so a lot of these virulence factors are produced at a little bit of a cost because the bacteria don't actually need them to exist in the wild. They only need them to cause an infection. So if we have a phage that can grab onto those virulence factors and identify bacteria that have them, then that puts a big cost to having this virulence factor. And so the easiest way often for bacteria to become resistant is for the population just not to have this virulence factor.
Okay. Wait. And how did you discover this?
So we discovered it by basically observing that in the very first case, once this bacteria became resistant to phage, they became really sensitive to antibiotics. And so once we saw that, we tried to identify the receptor of this phage, and then you go through and you find bacteria that have certain genes knocked out. And we found the phage couldn't infect bacteria that had genes involved in antibiotic resistance knocked out. And so we determined that those phages used antibiotic resistance genes as a receptor, or gene products as a receptor. Mm-hmm.
Okay. And have you ever altered phages to infect specific bacteria, like genetically alter them?
I have not. Others have, and I'm just not a very good engineer, but there are other people that are doing that kind of work.
Okay. Have you ever searched for a phage to treat a specific bacteria infection, like if you didn't have it?
Can you ask that again?
Yes. If you have like ever searched for a phage to treat a specific infection if you didn't have it in your collection?
Yes, definitely we've done this.
And yeah, okay. If a patient has more than one bacterial infection, do you treat them all at the same time or one after the other?
So our strategy here is to treat one after the other. We're trying to take a more targeted and sort of approach that's a little bit more predictable, because we don't know if we try to kill all of them, what could happen. It's harder to identify what might, the population, how it might respond, or the community. But other people try to target all of them. But I think in our case, we're lucky just because the cases aren't so severe or like an emergency that all of them are the causing the problem. It's just a gradual decline.
And how do patients receive the treatment?
It depends on the nature of the infection, but for us, we treat primarily pulmonary infections. And so in those cases, people just inhale the phages through a nebulizer.
And how do doctors get in touch with you when a patient needs a phage treatment?
Email, usually, but my phone number is on the web somewhere, so sometimes they call me if it's an emergency, but usually it's email.
And you always work with the same hospital, or it changes?
Yeah, so we've treated most of the patients here in Yale, but we work with anybody that's interested. So physicians from all over the world contact us, and we're happy to work with them.
Yeah, okay. Yeah, if the phages that you have prepared don't work, what do you do?
So before I prepare them for treatment, I test to make sure they'll work. But if during treatment all of a sudden they stop working, then we would just use different phages.
Okay. Why do you think that phage therapy hasn't been approved by the FDA?
Because it hasn't been through proper clinical trials yet. We're working on that, so we hope to have a trial starting this year or next. But just that's the reason. It just hasn't been through trials yet.
So you think it will be approved soon?
I hope so.
Do you think that phage therapy is the future for treating bacterial infections and the solution for antibiotic resistance?
I think it's one possible solution, and it certainly could be used in the future as a tool to help treat some of these infections. Yeah.
And what is one disadvantage that you see in the use of phages as opposed to antibiotics?
They are larger, so I think there's a concern that the immune response might prevent them from working, or the route of administration might be a little bit more difficult, depending on the infection. But other than that, I don't see very many major disadvantages.
Okay. And the last question is, what projects are you currently working on?
Oh, so many. We're always trying to isolate new bacteriophage, right? So we're getting them for all sorts of bacteria, but we're working to treat pulmonary infections, of course, from Pseudomonas, Klebsiella, Staph aureus, Achromobacter, Burkholderia. We're also working a little bit for intestinal infections from E. coli, Shigella, and Vibrio. And that's the major focus right now. But we get inquiries from people with urinary tract infections and bloodborne infections that we're always trying to help out with. So that's what we're doing.
Okay.
Okay.
So, yeah, that's all the questions.
Oh, it was so easy.
Yeah.
Yeah.
Thank you so much.
Yeah, anytime. And if you have more, you can always call me again or text me or something. Okay?
Yeah, great.
Cool. Good
Thank
luck
you.
on your project.
Bye. Thank you so much.
Uh-huh.